Well, good evening. We're so glad to be back with you guys live with CJH. My name is Kim Hess, and I am president of the Cassie Join for Hope Foundation. And we are happy to be back doing live with y'all. We took a little time off over the summer. That being that September is National Suicide Prevention Month, we thought it was important for us to get back on here and start spreading some more resources and some information out there in our community, start aligning with other mental health organizations and just really raising the awareness of suicide prevention this month, because suicide is preventable. So and this week, September 6th through 12th is National Suicide Prevention Week. So it's really important for us as a whole, as a community, to really just raise the awareness and share information, start having those important conversations with your family, with your children, with your loved ones. And if you see someone who is struggling, please reach out to them. Don't let them suffer in silence. Be the voice for them. Be the life preserver for them, because one person can really make a difference in someone's life, and one person could save a life. So let's all spread some hope this week and continue throughout the entire month of September and even beyond. So thank you for joining us in our mission. And I am very excited tonight to have Dr. Anna Brown with us. She is with the Eating Recovery Center here in the Woodlands. And thank you, Anna, for being with us tonight. And so we're so excited to have her, and I'll let her introduce herself and tell us a little bit about your background and what you do at the Eating Recovery Center.
Yeah, thank you, Kim. Really excited to be here this evening, and I share in your enthusiasm for getting the word out about resources in the community. So thank you for inviting me to talk a little bit more this evening about Insight Behavioral Health and Eating Recovery Center. As Kim mentioned, I'm a licensed psychologist and clinical director for, I actually oversee both programs at Insight Behavioral Health and Eating Recovery Center here in the Woodlands. And let's see, I've been now with both of those programs for 4 years, and have just really enjoyed seeing the growth with programs and being able to meet the needs of our community, whether that be with eating recovery or in recovery from mood and anxiety concerns. So I'm really excited to share with you all this evening about what it is that we do, and how we might be a resource for you or someone you know.
Wonderful. So we have Insight Behavioral Health Center, and we have the Eating Recovery Center. And so as you explain it to me, and I'll let you explain it, but they're kind of sister organizations. Is that right? To kind of explain how it works?
Yes. So both programs are conveniently located at the same address. We operate out of one of the professional buildings on St. Luke's Medical Campus. And we have 2 separate programs that we currently offer. I'm going to start with Insight Behavioral Health. This is our program where we focus and target mood and anxiety concerns, primarily with adolescents. We have seen so much growth in the program, though our goals for future growth are to expand that to adult services. But currently, we're treating adolescents age 12 and up. And so someone might be a good candidate for that program if they identify that the anxiety that they're struggling with or the mood concerns that they've been having have really been interfering with their functioning to such an extent that maybe they can't participate in their kind of normal daily activities, right? So maybe it's affected their socialization, maybe it's affected their functioning in school. They're just not themselves. They've kind of lost their personality, or they're becoming more and more preoccupied, with their mood concern or their anxiety struggle. And so once it's kind of gotten to that point, that would probably, make them appropriate for our level of care and what we do. We offer 2 different kinds of level of care within the Insight behavioral health program. So Our more intensive level of care is what we refer to as partial hospitalization program. I'm going to call it PHP for short, because that's sort of a mouthful. But in the PHP program, again, this is for someone who's really having a great deal of interference from their mood struggle or their anxiety, and they really need a lot of support throughout the day. So someone in that program would attend our program Monday through Saturday, so 6 days a week, and we program about 8 hours a day. So it's fairly intensive, you can imagine. So people do have to kind of suspend the other things that they, have going on to be able to dedicate themselves to that level of care. They may be in our care for about a month's time, but during that time is when they're really focusing on regaining their health, right, and their mental wellness. So they're learning coping skills to help them navigate the things that have been really challenging. So they'll also be working with a multidisciplinary team. So they're working with a therapist. They'll also have a psychiatrist that could help if medications may be appropriate to help them address anxiety or mood issues. And of course, all the while we're assessing safety and making sure that the individual is feeling safe and able to be at home. If safety were a greater concern, then we would look at a higher level of care, maybe someone that might need 24/7 support to really feel
More
safe.
residential type.
Correct. Yeah. So we do not offer residential at the Insight in the Woodlands, but we do have Insight does have residential. Our nearest location is actually in Chicago, and they have a dedicated adolescent residential unit. And we work very closely with them, even though they're many miles away from us. So they've been a great resource, and we're really hoping to expand those services into Texas here very, very soon.
That'd be wonderful.
Yes.
Okay, so so this is 8 hours a day, and then you come home. They sleep at home.
Correct.
You go back.
Correct. Yes. And that being home part, if I may, Kim, so obviously we want parents to feel equipped, when their child is at home, that they're able to support them. And so, we really feel like the parents are an integral part to the success of and recovery for the kiddo. So we want the parents really involved, and we do that in a number of different ways. We have parent support group where parents come in. Now this is all virtual, but parents attend weekly, and we're really providing them support and skills, for how to navigate the unique challenges of having a kid in treatment and a kid that's struggling with maybe mood and anxiety issues. Additionally, there's individual family meetings with one-on-one with a therapist. And so we really feel like it's really important, that the parents are involved and have the support that they need to help their child along.
Absolutely. I mean, I've learned that parents are such a huge part of the recovery process and
Yes.
lifelong support.
Yes.
It's important for us to know as much and to learn from other parents. Learning that alone, just learning from other parents is huge. So when they're at the PHP, are they doing schoolwork there?
Yeah, so great question. As I mentioned, right, someone to take that kind of amount of time in their schedule to attend this intense level of treatment, they've really had to put other things on hold. So, you might think that that's school. We do try to accommodate people being able to keep up with their studies to the best extent possible. Obviously, the focus is on helping them with the other challenges that are going on. So that's really the primary focus. But we don't want a consequence of that to be falling behind in school. So we do have a certified school teacher on staff with us, and we provide set aside school time 10 hours a week so that someone could continue to focus on some schoolwork during their journey. And now, with things being what they are these days, with so many things being virtual, it's actually seemed to work pretty well. For a lot of our folks, they're able to log in and do virtual school for a couple hours a day in between some of their therapy groups.
Yeah. It's amazing how these kids can adjust to
Yes.
online school so quickly.
Yes, exactly.
Okay, so they're getting one-on-one therapy with in-house counselors. They're getting therapy from a psychiatrist. Is that in-house or is that
Correct. That's all in-house.
okay?
Mm-hmm.
And then they're getting support group
Mm-hmm.
meetings throughout the day from
Yes.
with their peers. Now, is this all in during this COVID time? Are they actually physically together in this room, or are they?
We are, yes. We've taken a lot of precautions to keep our programming safe for patients and staff and families alike. So it does look a little bit different in the age of COVID, but our partial hospital programming is still all live face to face. That's all happening in person on site. And really the thought behind that is, I mean, when someone really requires that level of care, that need is going to be best met face to face. And we want to be able to provide that. So we've put a lot of precautions in place to help keep the on-site care safe. And to date, we've had no positive patient cases, and we're really proud of that. We feel like the precautions that we've been taking have really been effective. One of the things that we have done to help make that a success is taking our intensive outpatient program, which is our kind of next level of care. We've taken that off-site. And so that level of care is being done virtually over a platform similar to Zoom that is secure and confidential. But we're providing that service and those group programming off-site at this time. And again, that helps us reduce some of the numbers of folks kind of on site or campus with us. But we've really seen a tremendous turnout and success with the virtual programming. We've been really pleased. This is something that our company has actually been offering virtual programming at the intensive outpatient level of care for about 3 years prior to COVID. So the infrastructure of that was kind of already in place and really set us up to be able to do that well when the unexpected need arose this spring. So we were, kind of in a good position to be able to do that and respond to the need. But we've been really pleased with how that's been going, and just glad that we could continue to meet the need despite all the other changes we've all had to be dealing with.
Isn't that the truth? So how does someone well, first of all, do they need to be referred by another doctor to get to?
You do not. No, you do not. So it's great if you are, and we do love to collaborate with providers that you might already be working with. So we will absolutely make every effort to communicate with an outpatient team member. If you've identified them and let us know that you're working with them, we are going to want your permission to reach out to them and communicate with them so that we can really get a good sense of, how you've been functioning and, why you might need an additional support like this program. And we want them to be in the loop so that after you've completed the program, they feel like they've been along the journey with you. They know what's going on. So we really pride ourselves on communicating with the outpatient team, but it's not a requirement to have an outpatient team to come see us. So a lot of folks will find us just by a Google search, and that's just fine. If you call our intake kind of hotline number, our assessment line, our assessments are free of charge, and they're completed by a master's level licensed clinician, and will then make a recommendation on level of care, and you can make a choice or determination at that point if you'd like to proceed. Okay. So the assessment does not obligate you to accepting care with us, but just gives you an opinion, about what choices you may have.
And so is that done online now, or do they physically come to the office to do that assessment?
So the assessments used to be face-to-face. Currently, we're doing those all virtual. So we've limited our visitors, coming onto campus at this time. But yes, so that can all be done over a platform like Zoom.
Okay. And then once someone's assessed and y'all find the right program for this patient to be in, what's the turnaround time period for them to start a treatment?
Yeah, usually pretty quick. We like to get people in about 24, 48 hours is really our goal. We like to move fast. And reason for that is, if it is determined that PHP is the right level of care for you, obviously there's a lot going on, and we want to get you connected with the resources as fast as possible. And so, we also want to be conscientious of any barriers that might be at play. So we'll work with people on financial circumstances that could be a barrier. We have a foundation that provides scholarships. We have housing that we can provide temporarily if they live, a distance away from the center that might prevent them, from being able to make the commute every day. So we do have an apartment, that we can provide. We can assist with transportation. So we really try to make a lot of effort to, whatever the barrier is, we want to see if we can do something about it to get you connected.
Oh, wow. That's amazing. And so I assume that y'all accept insurance?
We do. We're in network with all major providers. So yeah, we're in network.
So really, y'all will work with every, sounds like y'all work and do everything you can with every patient, every family to try to get their child into the treatment program one way or the other.
Yes.
Okay, so that was what the PHP, the partial hospitalization treatment, looks like. The IOP, the intensive outpatient program, what is that? That's just how many hours a day is that, and what does that look like?
Yeah, so I mentioned it's kind of our next tier of level of care, so less intense, and usually someone is appropriate for this level of care when the degree of interference in their functioning is less. Usually they're able to continue going to school and participating in kind of normal activities that way, but they still need the support. So I kind of think of that IOP level of care as, okay, I've mastered some of the skills, and now I'm like applying them. I'm kind of reintegrated back into my life, and I'm really working on the application of the skills and doing that really consistently. And so that level of care meets for group 9 hours a week. And again, that's all virtual. They're not coming on site at this time, but we're programming. The groups are virtual, and then you'll also have virtual one-on-one meetings with your therapist as well, and that would include family therapy and family contact, and of course working with the outpatient team as well.
Okay. So it sounds like that is like if the patient has started in the PHP and they finish that, then they kind of step down typically to the IOP. Is that correct?
Yeah. It doesn't always have to go that way. Sometimes people come straight into the intensive outpatient program. So maybe, that might be someone that's been working in with an outpatient team with a therapist they're seeing weekly, but maybe they're just getting, stumped up on something and they need a little bit more support. And so the therapist might recommend a program like that. And so we'll help them with a little more in-depth with the skills, and they just get that added frequency of contact, with a therapeutic team member. It usually helps them kind of get back on their feet, and then they're ready to resume just the weekly meetings with their therapist.
That's awesome. And so both these programs typically 4, 6 weeks.
Yeah. The PHP program is generally about 4 weeks long. That tends to be a good average. And then, and certainly there are circumstances, that one may be longer or shorter stay than that. But, and then with our intensive outpatient program, anywhere from really like 4 to 8 weeks is kind of what we see, just depending on the need.
Okay. Okay. So now let's kind of move over and talk a little bit about the Eating Recovery Center. I know this is what you specialize in, eating disorders, right?
Yeah. So I do oversee both programs, and eating disorders have kind of been my niche. But yeah, so the Eating Recovery Center side of things is focused on kind of what it sounds like, folks that struggle with eating problems of some kind. And so in that program, we treat adolescents age 12 and up, and then we also treat adults. And the adolescents and adults program separately, and we offer the partial hospital level of care in addition to the intensive outpatient level of care. And same as I was describing with Insight, we are doing the partial hospital level of care in person, and the intensive outpatient level of care is virtual.
Okay. And I assume, and they're both kind of, the PHPs kind of works the same way as the Insight Behavioral, right?
Yeah. So one I guess kind of nuance to it that's a little bit different. Obviously, since food seems to be at the center of the struggle, the therapeutic day is organized around meal times as well. So that ends up being an important component or aspect to the treatment day that's a little bit different from Insight. So we'll have the patients eat with us in the partial hospital program. They'll have 3 meals and 2 snacks a day with us. So the day is a little bit longer so that we can provide that dinner and after dinner support. And they program 7 days a week. Um, so
Okay.
so again, a pretty intense program, for being a partial hospital level of care. That's kind of a differentiating factor for both of our programs. We don't often see partial hospital programming that is that many hours a week, but we have really found in our experience and working with so many patients that that's kind of what it requires, to really support the changes that are necessary and the healing that's necessary. So we recognize it's a commitment for folks to come in and take that many hours out of their lives, and that's really what is required, to do this very hard work that they're doing.
So through many of our Zoom discussions, and certainly through a lot of our speaking events, we've talked a lot about the signs, the warning signs when someone might be depressed or suicidal. Let's talk a little bit about eating disorders. What are some of the signs? Well, first of all, what different type of eating disorders are there? And then second part is, what are some of those signs that a parent should look for to recognize if their child might have an eating disorder?
Sure. So we treat all types of eating problems at our facility. So you kind of think of maybe the ones that you've heard most about in popular culture, like anorexia nervosa or bulimia nervosa. And we certainly treat those. Those tend to be the ones that kind of come to the forefront of people's minds when they think about eating problems. But we also treat binge eating disorder. So, these are folks that really struggle with overeating. It is, different than obesity. It's a distinct issue, related to consuming a large amount of food, more than the average person would say. That's a lot of food, and doing so in a really discrete period of time, and feeling really out of control with that. Our Houston facility, we have a sister facility in Houston, Eating Recovery Center, and they have a specialized track for binge eating disorder for adults. And that's been very successful, and a great resource to have access to in our community. We will also treat binge eating disorder at our facility here in the Woodlands, but we don't have a kind of separate track. So I mention that because our group is pretty heterogeneous. We'll have folks with all different kinds of struggles and all different kinds of backgrounds coming in, and so it's nice to be able to offer people the choice of where they program for what what might be the better fit for them. You know, if they want to be with people who have similar struggles or are open to being with kind of a mixed group. So we have access to both, which is a nice to be able to have a choice. We also, of course, see eating disorders that maybe don't fit a very clear category. You know, someone has maybe struggled with not eating enough, and then they also occasionally will eat too much, or then compensate with that with exercise or vomiting, things like that. So, you know, there's some other diagnoses in there that we will treat that aren't kind of your clear cut that you think of, like anorexia or bulimia. And then we also treat what's called avoidant restrictive food intake disorder, otherwise known as ARFID. And this is an eating problem that's usually diagnosed in childhood, where if you think of like the kid who's just a picky eater, or kind of when they transitioned from you know, breast milk or formula to solid foods, they kind of rejected a lot of foods,
Right.
and kind of just got down to their very few specific foods that felt safe to them, that they really preferred. And you know, those kids sometimes end up struggling with growing on their growth curve, you know, as would be expected. Maybe weight hasn't been where it needed to be, or their height has been stunted because they didn't meet all their necessary growth requirements. So we do treat that as well, and see that a lot in our adolescent program as well as our young adults. You know, sometimes people don't seek treatment for that, you know, thinking, well, I'm just kind of a picky eater, not really recognizing.
Or something.
Yeah, it's a phase. I'll outgrow it as I get older. And then they get to college and then realize that's really become like a barrier for them, you know, in being able to socialize normally, or go out and date, or whatever it may be. So so we will get, you know, kids from coming home from college and have decided it's really time for them. They want to address that and figure out some more flexibility with that. So we treat all kinds of eating concerns. The one thing I will say, you know, eating disorders have obviously a lot of co-occurring medical concerns that come with them, that can make them kind of complicated to treat. So we do have a multidisciplinary team, you know, of specialists that are there to support the care that the patient's receiving at ERC. So the team consists of a medical physician, obviously therapist, psychiatrist, nursing staff, and registered dietitians, who are then, you know, really providing the recommendations related to the food itself. But if someone's eating disorder is such that they've really become medically compromised, more often than not, we will need to start at a higher level of care than what we provide here in the Woodlands. So they may need residential or even inpatient, just to get stabilized medically before they're appropriate to come, you know, to PHP like what we do, and benefit from that level of care.
And then where can they get that? In Houston?
So Houston is outpatient also. So they do PHP and IOP. Our nearest residential and inpatient facility is in Dallas, and you know, they've really grown over the past year, opened up many new beds, and we're able to accommodate a lot of the needs for our state. So
I know that eating disorders, if not addressed and treated, can lead to other mental health disorders like depression, anxiety, and may even lead to suicide. So have you, I mean, how does that, I mean, can that turn over pretty quickly if not addressed? I mean, have you seen that when you're, you know, in your experience?
Yeah. So eating disorders like rarely exist in a vacuum. The vast majority of our patients, you know, 85–90% of them also have a co-occurring mood or anxiety diagnosis. So we see a lot of kind of generalized anxiety, like a lot of worry. We'll also see obsessive compulsive disorder And we see a lot of depression, sometimes bipolar disorder. And I mean, if you think about, obviously having a mood concern like depression or bipolar, that can affect your eating, right? So people can lose interest in eating, and then an eating problem may become more severe, significant, come about that way. And then alternatively, having an eating disorder and not taking in enough nutrition can really affect your mood. And so then depression can come about that way. So we see this co-occurrence a lot. And yeah, you're right. Eating disorders have the highest mortality rate of any mental illness diagnosis. And a few reasons for that. I mean, we talked about the medical complications, can affect all systems of the body when you're not eating or overeating. Pretty much every part of the body can be affected. And so that can cause, obviously, a lot of grave health concerns that could lead to death. And then the other, leading cause of that within eating disorders is suicide because of the co-occurring depression and really the isolation. There's a lot of patients that identify a great deal of shame with the eating concerns that they have, and the eating disorders have often come about in secrecy. So you can't like look at someone and tell that they have an eating disorder. So they're not always easily detectable. Right. And usually someone's gone through, some great lengths to kind of keep it to themselves and hide the fact that they're struggling with that. And so for those reasons, these things can go on under the surface, and the shame and isolation from that can be another really big contributing factor to the risk of suicide.
Have you seen the how social media has affected eating disorders? I mean, I'm not gonna. I assume it's mainly females, but I know males are affected by it as well. But the body image, comparison to everyone, especially on all their social media handles and everything. I mean, do you think that has caused a rise in eating disorders as well? I mean, I know it has contributed to suicide rates for sure.
Yes, yeah. It's been studied, that there's certainly some contribution there. And just looking at Western culture in general and the emphasis put on like it matters what you look like and it matters what you eat, and you should really be conscious of what you're putting in your body. I mean, you can't go anywhere without being bombarded by those kinds of messages, right? So right. Yeah, that's certainly a factor, but eating disorders are rarely, ever come down to kind of like one contributing thing. It's always like a combination of stuff. And so we'll see a biological influence, like there's a a genetic predisposition, right? There can be a strong genetic component to that if someone else in the family has struggled with eating problems, or even if someone in the family has struggled with mood and anxiety, struggled with depression. Eating disorders can come about as like a means of coping. I have figured out that when I eat less, I feel less anxious, or I feel like I'm in control of something. So they're kind of like this imagined survival skill, if you will, and kind of come about that way. So not necessarily about like changing something about your appearance, but I just kind of discovered that by tweaking how I eat or adjusting my diet or exercising more, I felt a little different. And then next thing you know, right, it's kind of this perfect storm of factors that can lead to a real disorder. So there's kind of psychological factors, and then obviously the social component. Yeah, I mean, our society is rife with all of the kind of commentary and opinions about what you look like matters, and you should really care about that. So it's hard to ignore.
It's hard growing up in today's society as a teenager. Oh my gosh.
Yes.
So are there any not so obvious signs that your child may have an eating disorder, that may be apparent, that you can kind of let parents know what to look for?
Yeah. So as I said, you can't always just look at someone and tell, that they do. I think that's kind of one of the biggest misnomers is that you can look at someone. We think, our movies and media have kind of given us this impression that eating disorders look a certain kind of way, and they look like a really emaciated female, and that's not really the case. We see. About 20 million women, females, in the U.S. struggle with eating disorders, and we estimate about 10 million men. And so we think that men actually underreport because of the shame, of having maybe like a girl's illness or a female struggle. But we also think that probably physicians um, may not know what questions to ask, or there may be like an unconscious bias that they're not checking in with their male patients about what they're eating, and so just don't check in about that, and how they're doing with those types of things. So when thinking about it from like a parent's perspective, and what kind of changes or concerns the parents might be noticing, sometimes it starts with just a change in their mealtime habits. You'll notice that they're eating more, eating less, or avoiding meal times, avoiding eating as a family. The types of foods and when they eat has changed. Maybe they're exercising more, those kinds of things. Some of the more, things that may come to mind might be like, oh, they're leaving the table and going to the restroom and staying in the restroom after they've eaten for a while. And then more subtle signs would be like changes in personality, just seeing kind of like they've lost their sense of humor, they're not seeming themselves, or they're isolating more in the room.
Yeah.
Sometimes going back to social media, parents have told me they have found, just been curious about what their kid is looking at on the internet, and discovered some warning signs that way. They're pinning things on Pinterest about diets and workouts and things like that, or what kind of things they're following on Instagram, those types of things.
Yeah, that's why it's so important for parents to be aware and observe what your children are looking up, and check their phones regularly. Oh my gosh. Yes.
Yeah.
Okay. And then are there, so post treatment for both behavioral, insight behavioral and eating disorders, are there any support groups that y'all offer through your programs after treatment for
Yes.
patients and parents or families?
Yeah, we have what we call an alumni support group that's offered to alumni from our program, but we've also expanded that and opened it up to the community. You do not have to have been a previous patient of ours. You could have been treated at a different facility or have not gotten treatment yet at all to reach out. That's okay. But we do have a support group, and that information is on our website through our alumni programming. And then we also offer ongoing support to parents. We have an active Facebook presence with parents that they can log into. It's a private group, but log into for ongoing support. And we have alumni and family relations liaisons that will then also reach out and stay in contact with families after they've discharged our care, to continue just to assess if there are any ongoing needs, or needs for resources, and help connect them with those.
And what is your website?
eatingrecoverycenter.com.
Okay. I think we have that on our Facebook post, but we will definitely add that if we do.
Yeah.
So, and all of this information, it can be found on the website.
Yes. Oh, yes. And for eating, I'm sorry, for Insight as well. You can find Insight behavioral health center.com.
Okay. So yeah, we'll put both those links on this post. And so the best way for a patient, a parent, if they see signs in their child, just to call up at the center, and then they will start the assessment via online.
Yes, you can call the center directly and we can connect you with an assessor, but also our toll-free assessment like hotline number, and you can access that. We have a response team that is always standing by the phone, and they will take the call and help get you scheduled with an assessment at the earliest, convenient time. So that's all available on our website as well. It should be like right at the top.
So that hotline number, the assessment team, is that 24 hours?
Yes.
Oh, wow. Okay. That's great to know. Okay. Is there anything else that we didn't touch on that you wanted to add or anything? I think I got all of my questions answered, and I don't think we have any questions come in on our Facebook.
Okay.
So
I want to thank you again for the opportunity and for what you're hoping to accomplish with this, and just getting the word out about resources in our community. I think it's so great.
it's so important. It's so needed. Yeah. Well, thank you for being part of this. And I'm so happy that we got to put your information out there and learn a little bit about both behavioral health inside Behavioral Health Center and Eating Recovery Center. So both here in the Woodlands. They're at St. Luke's building, correct? On St. Luke's Way and I-45 over there. Okay.
Exactly. Yeah.
Awesome. Well, we will add your links to our post, and thank you all for listening. And Anna, I can't thank you enough. Hope you have a great rest of your week. Everyone go out and hug your loved ones this week and let them know how much that their lives matter, and just spread hope. So, all right, guys. See you next week.
Thank you.
Bye-bye.
Bye-bye.
I think I ended it.